So what we have to keep in mind when we're doing these exercises is that in level 1, we learned that we need to respect a few principles when we're doing some exercise for people that have abdominal dysfunctions or diastasis-related abdominal dysfunctions, such as make sure that when you're doing an exercise, you pay attention to having stretch or mobilize restricted areas first. So you can't really ask a muscle to function optimally if the section where it's originating from or where it's inserting to is not moving properly. So the first step is really, if you have to do some mobility exercises or if you have to do some soft tissue release first, then it is your first step. You have to do that prior to doing your training exercise. You want your muscle to be able to control that motion. Well, for that, you need that motion to happen and not be limited. So second principle is really the alignment. So make sure that you do find that proper alignment where you have thoraco-pelvic alignment that allows tension-free diaphragmatic breathing and where you will have optimal inner unit recruitment of your inner unit muscles. Also, you want to make sure that you do work with that breathing to control the intra-abdominal pressure, so that blow before you go that we have been so inspired by Julie Weeb from. So we want to include that, especially because we're going to higher loads. You want to make sure that that pressure system is working and being controlled. And you want to make sure that you do have that inner unit recruitment, that that person is able to feel that she's contracting her muscle prior to engaging in these exercises. So these principles have been, yes, taken from all the experts in women's health that we have interviewed for our research that we presented in level 1. It's also some of the principles that are used by many experts in the field, such as Diane Lee and many other very athletic therapists have been using and promoting the importance of moving and being in proper alignment and breathing and making sure that you have proper muscle recruitment. So we're not reinventing the wheel here. We're just trying to reinforce how it is important to integrate these principles in our exercises. But so if you're having trouble including these in the advanced exercise, make sure that you go back a step, that your control, that your alignment improves, and then you can add that loading to your treatment plan so that you don't lose focus of function, even though we're aiming for tone and stiffness with these exercises.